بسم الله الرحمن الرحيم وبه نستعين. اللهم صل وسلم وبارك على سيدنا محمد وعلى آله وصحبه أجمعين. I am د.انصاف ابراهيم حسين الشمري, lecturer in Department of Pharmacology, College of Medicine, الانبار University, Iraq. My lecture for third stage student in pharmacology subject. My lecture today is Tetracyclines and Glycylcyclines. Tetracyclines and Glycylcyclines. The class of these antibiotics is protein synthesis inhibitors. Well, first of all, we must talking about protein synthesis inhibitors. A number of antibiotics exert their antimicrobial effects by targeting the bacterial ribosome. In general, the bacterial ribosome is smaller, is 70S, than the mammalian ribosome 80S. Also, the mammalian mitochondrial ribosome more closely resembles the bacterial ribosome. Thus, although drugs that interact with the bacterial target usually spare the host cell, while in high levels of drugs may cause toxic effects as a result of interaction with the host mitochondrial ribosomes. A protein synthesis inhibitor antibiotic include tetracyclines, number 1 tetracyclines, number 2 glycylcyclines, number 3 aminoglycosides, number 4 macrolides, number 5 chloramphenicol, number 6 clindamycin, number 7 quinapristine, daflopristine, and linezolid. Here we are talking about tetracyclines. The tetracyclines consist of 4 fused rings with a system of conjugated double bonds. So the chemical structure of tetracycline consists of 4 fused rings with a system of conjugated double bonds. The mechanism of action of tetracycline: when entry of tetracyclines into susceptible organism or bacteria is mediated by passive diffusion or by an energy-dependent transport protein mechanism innocuous to the bacterial inner cytoplasmic membrane. So the antibiotic entry to the susceptible organism by passive diffusion and by an energy-dependent transport protein. Then, after entry of the drug, then the drug binds reversibly to the 30S subunit of the bacterial ribosome, thus blocking excess of the amino acyl transverse RNA to the messenger RNA ribosome complex at the acceptor site, lead to inhibit bacterial protein synthesis. So tetracycline considered as the mechanism of action of tetracycline is bacterial protein inhibit bacterial protein synthesis. Here In this figure, show the chemical structure of tetracycline. All of the tetracycline have the basic structure shown below, and list member of tetracyclines as chlorotetracycline, oxytetracycline, tetracycline, dinucleocycline, methacycline, doxycycline, minocycline. These drugs differ or the differences among these drugs in position R7, R6, and R5. For example, chlorotetracycline in position R7 there is chlor, and in the R6 there is CH3, and in the R5 there is H or hydrogen, while oxytetracycline in 7 position there is H and CH3 at RH position and OH at R5. Tetracycline R7H and R6 CH3 R5 there is H hydrogen. Dinucleocycline there is chlor at RH7 H hydrogen in both R6 and R5. Methacycline there is H at R7 CH2 at R6 and OH at the R5. Doxycycline H in the R7, CH3 in R6 and OH in the R5. Minocycline N or CH3 by 2 in R7 and H in R6 and also H in R5. There is no OH at position 6 on methacycline and doxycycline. Also here in this figure show renal clearance for these drugs mol per minute, such as chlorotetracycline 35 mol per minute, and oxytetracycline is 90. The clearance is 90 mol per minute. Dinucleocycline 60, tetracycline 65, dinucleocycline 35, methacycline 31, doxycycline 16, and minocycline 10. So this figure here show the general structure of tetracycline and the differences among these member of tetracycline in position R7, R6, and R5. Classification of tetracycline. Tetracyclines are classified as short action or short acting, intermediate acting, and long acting. This classification based on serum half-lives. So, according to the serum half-lives of tetracyclines, we can classify it as short-acting, involve chlorotetracycline and tetracycline. Number 2, intermediate acting, include dinucleocycline. 3, long-acting tetracycline, such as doxycycline and minocycline. Antibacterial spectrum. Tetracycline are broad-spectrum bacteriostatic antibiotic. So, tetracycline considered as bacteriostatic effect antibiotics. The tetracyclines are effective against gram-positive and gram-negative bacteria including anaerobes, spirochetes, mycoplasma, chlamydia, and rickettsia, and against some protozoa. The antibacterial activities of most tetracycline are similar, except that tetracycline-resistant strain may remain susceptible to doxycycline or minocycline. So all members are similar in the antibacterial activities, except tetracycline-resistant strain may remain susceptible to doxycycline or minocyclines. Resistance to tetracyclines. This resistance caused by number 1, inability of the organism to accumulate the drug, thus producing resistance. 2, enzymatic inactivation of the drug due to presence of enzyme which inactivate the drug, so result in resistant to the drug. 3, the production of bacterial proteins that prevent tetracyclines from binding to the ribosome. Pharmacokinetics of tetracyclines include absorption, metabolism, absorption, distribution, metabolism, and excretion. Number 1, the absorption. All tetracyclines are incompletely absorbed after oral ingestion. However, taking these drugs concomitantly with the dairy foods in the diet, this leads to decreased absorption. Why? Due to the formation of non-absorbable chelates of the tetracycline with the calcium ions. Also, non-absorbable chelates are also formed with other divalent and trivalent cations. Distribution of tetracycline. Tetracyclines are distributed widely to tissues and body fluids. They bind to tissues undergoing calcification, for example, teeth and bones, or to tumors that have a high calcium content. Although all tetracycline enter the cerebrospinal fluid, levels are insufficient for therapeutic efficacy. So, the tetracycline are distributed widely to tissue and body fluids. Metabolism and elimination of tetracyclines. All the tetracyclines are metabolized in the liver and conjugated to form soluble glucuronides. The parent drug and or its metabolites are secreted into the bile. While most tetracyclines are reabsorbed in the intestine via the enterohepatic circulation and enter the urine by glomerular filtration. So, tetracycline are reabsorbed for this antibiotics. These are reabsorbed in the intestine via the enterohepatic circulation and enter the urine by glomerular filtration. Unlike other tetracycline, doxycycline can be employed for treating infections in renally compromised patients. Why? Because it is excreted via the bile into the feces. So, unlike the other tetracycline, doxycycline used in the patient with renal impairment. Why? Because this drug excreted via the bile into the feces, not excreted into the or excreted by renal routes. Clinical uses of tetracyclines. 1. A tetracycline is the drug of choice for infections with mycoplasma, pneumonia, chlamydia, and rickettsia. 2. They are used in combination regimens to treat gastric and duodenal ulcer disease caused by Helicobacter pylori. 3. Tetracyclines rapidly stop the shedding of vibrios in cholera, but tetracycline resistance has appeared during epidemics. Other indication for tetracycline, usually in combination used with aminoglycoside, is indicated for brucellosis. 5. A tetracycline is indicated in the treatment of some spirochetes as Lyme disease and leptospirosis. 6. Tetracyclines are sometimes employed in the treatment of protozoal infection, such as those due to Entamoeba histolytica or Plasmodium falciparum. So, tetracycline used in protozoal infection, such as disease caused by Entamoeba histolytica or Plasmodium falciparum. Other indication of tetracyclines, minocycline can eradicate the meningococcal carrier state. 8. Dimeclocycline inhibits the action of ADH in the renal tubule and has been used in the treatment of inappropriate secretion of ADH hormone or antidiuretic hormone. 9. Tetracycline may be used in serious gram-positive and gram-negative infections. Adverse effect of tetracycline. Number 1, gastric discomfort. Epigastric distress commonly results from irritation of the gastric mucosa. Thus, the epigastric distress can be occur due to irritation of tetracycline to the gastric mucosa and is often responsible for non-compliance in patients treated with these drugs. Number 2, effect on calcified tissues. Due to deposition of tetracycline in bone and primary dentation occurs during calcification in growing children. This causes discoloration and hypoplasia of the teeth. Fatal hepatotoxicity. The side effect has been known to occur in pregnant women who receive high doses of tetracycline. So, when the pregnant woman receive high doses of tetracycline, lead to fatal hepatotoxicity. Other side effect, phototoxicity. Phototoxicity such as severe sunburn can occur when a patient receiving a tetracycline is exposed to sun or ultraviolet rays, and this is toxicity can be frequent with tetracycline, doxycycline, and dimeclocycline. Contraindications. Renally impaired patient should not be treated with any of the tetracyclines except doxycycline. Accumulation of tetracyclines may aggravate pre-existing azotemia. That means a higher level of urea than normal level or other nitrogen-containing compound in the blood. The tetracyclines should not be used in pregnant or breastfeeding women or in children less than 8 years of age. So tetracycline contraindicated in renal impairment patients, in pregnant women, in breastfeeding women, as well as in children less than 8 years of age. Glycylcyclines. This group of protein synthesis inhibitor involve Tetracycline. Tetracycline is the first available member of Glycylcycline. Tetracycline derivative is a derivative from minocycline and structurally similar to the tetracycline. So tetracycline is similar to tetracycline, and also it is derivative from minocycline. Tetracycline has a broad spectrum activity against multi-drug resistant gram-positive pathogens. Also act against some gram-negative organism and anaerobic organism. Tetracycline is indicated for treatment of complicated skin and soft tissue infections, as well as complicated intra-abdominal infection. So, tetracycline used in the treatment of complication in skin and soft tissue. Mechanism of action of tetracycline. Tetracycline exhibits bacteriostatic action. So, tetracycline considered as bacteriostatic effect antibiotic. Action by reversibly binding to the 30S ribosomal subunit and inhibiting protein translation. Antibacterial spectrum of tetracycline. Tetracycline is expanded broad spectrum activity that includes methicillin-resistant staphylococci, multi-drug resistant Staphylococcus pneumoniae, and other susceptible strain of streptococcal species. Also, vancomycin-resistant enterococci. Pharmacokinetics of tetracycline. Tetracycline is extensively distributed throughout plasma and body tissue. Also, tetracycline does not undergo significant liver metabolism, but it is primarily eliminated via biliary into the fecal excretion. So, the excretion of tetracycline through the biliary, through the feces. Adverse effects of tetracycline. The main adverse effects being similar to tetracycline class, and the most commonly adverse effects were nausea, vomiting, photosensitivity, pseudo tumor cerebri, discoloration of permanent teeth when used during tooth development. So, the tetracycline when is similar, antimicrobial activity is similar to tetracycline, and it is derivative from also the nucleocycline. So the tetracycline is similar antibacterial activity to tetracycline, and it is derivative from minocycline. It is derivative from minocycline and has broad spectrum activity against multi-drug resistant gram-positive pathogens. And the adverse effect, the main adverse effect is also similar to tetracycline class. And the most common adverse effect were nausea, vomiting, photosensitivity, pseudomotor cerebri, discoloration of permanent teeth when used during tooth development. Thank you.